Hi, everyone, and welcome to another episode of Aila Health's Patient Spotlight series on long COVID. I am here today with Kerri Morrison, who is a long hauler and a fighter. She is a voice for those suffering from long-term effects of COVID-19, ME/CFS, and dysautonomias. Kerri is in the Louisiana State Lead of the COVID-19 Long Haulers Advocacy Project and a member of the Long COVID Alliance. Kerri is using her 25 years of experience in nursing and transplant to advocate for COVID-19 long hauler education, research, timely and equitable care and treatment. And I know for sure, Kerri, it is such an honor to have you here with us and to hear a bit more about your story. Welcome.
Thank you, Shannon. Thank you very much. It's an honor to actually be allowed to platform and raise awareness for such an important cause.
And you spend so much of your time giving voice to those who are struggling with long COVID and other invisible illnesses. But maybe the place to start is through hearing your own story and giving voice to that.
So, like you had said, I'm an RN. I don't work in a traditional setting, whereas I am not at bedside. I do have an office as a coordinator. I coordinate transplants. So there's some patient bedside time, and there's also clinic time. So I do spend time in the hospital, outside of the hospital, but mostly we're all meeting, all of us coordinators, surgeons, physicians are all in one big space with two little doors. So there's a collective of about 122 of us right at this. And a lot of the doctors were immediately what they call deployed to the COVID units. So there was a little bit of concern, it's the beginning of March and everybody's concerned about what's happening. And I tested positive on March 26th, which was pretty early on of 2020. And there was 4 symptoms at the time you had to have on those little boxes. You had to have a fever, you had to have a cough, you had to have shortness of breath, and you had to have, you might not have even needed a headache at that point. I'm not sure. But I blew it off because at first I didn't match the symptom list. So I started with the smell, my taste stayed, but my smell went to charred meat. And my eyes were burning. And I called, work and I said, hey, I'm concerned. And if you couldn't at that time answer the questions, which was every hospital in the nation, pretty sure, you had to report. So there were about 5 of us that were positive within the first 2 weeks of the pandemic, which is a pretty good number. We all had different, obviously varying symptoms. I was very sick in the beginning. I got pneumonia. And then I started having very strange rashes, shingles, things that were not lining up with the typical picture of COVID. Luckily, I am a good researcher and a lot of times was too tired or didn't feel well enough to write my symptoms. So I just took a photo diary. So I would take pictures of various bruising. It looked like I had chickenpox again. Then I started getting these weird blisters on my elbows. And then I started having shingles. And all I was told was, no, there's no way. No, that's not from this. And prior to COVID, I'll be 50 this month, big number. But I did HIIT workouts, trained almost daily. I have a 19-year-old son. I have a husband. Went to dinner after work. Lived my life. Could handle all of that and juggle on call for 24 hours. I couldn't all of a sudden walk up a flight of stairs. And my struggle with a lot of this is, as a nurse, is symptoms. Take the diagnoses off and evaluate what you're looking at. And transplant has perspective as it's not as piecemealed as care has become. It's more of a holistic view because there are so many what ifs in transplant. So what could happen? So it's my job to review a patient in totality and see what is happening, what is wrong, what is a potential, right? So in this arena, we deal in potentials. So that's where I'm coming from. So is this a potential? And to be told no right off the bat is confusing, because, like I said, I work in probability. So you have viruses that are reactivated. Potentially, we actually treat potentials. So why couldn't this potentially cause a reactivation and make something happen like shingles, you know? So to even right out of the gate have a constant battle of this isn't happening to you, you're not taking off of work, you don't meet criteria, was very confusing.
So what was it like for you to be in that place of navigating this very real sickness and illness that you were struggling with, and then also being dismissed by the medical professionals around you, and trying to do this, you know, navigation of like, you know, what is going on here and just the probability?
It became difficult. I actually had been working up to some capacity through recently up until May 20th, literally of last month, or 2 months now. But it was very difficult to separate. And also too, it's that whole, like, you know, you need to put your own oxygen on before you save somebody else. After a while, my oxygen tank ran out. It became an ethical issue for me a little bit too, as far as if you can't believe me, and this is a narrative that's being painted by someone you know, what is happening to others? What is happening to people that don't have a clue of the narrative that is being created for them by someone else? You know, and then I just became a little bit more aware of that struggle. And the more I fought, the harder it got. Where a conversation with a pulmonologist in transplant said, don't start, you know, let's wait for steroids. Okay. Well, it was documented that I refused them. That narrative started. And you know, it's just been a picture that has just somewhat met, well, why didn't you go, you're short of breath. Why do you need an echocardiogram? You refuse steroids. So that was my first glimpse of, oh God, what's happening? Like, I inherently believed naively that we're here to do the right thing. That's most people around me did. That's why you're in medical care, right? Is to take care of patients and people and listen. And that was a very hard realization that wasn't going to happen. So, I mean, to the point where, and interestingly enough, we've all heard the term medical gaslighting. I had not until this happened to me. I heard gaslighting, but never medical attached to it. Mostly, I read about a lot of stories, and I'm actually very passionate about raising awareness for that at this point, because I do think it impedes care and quality. And this is a timely disease. If you don't catch things in certain time of a fashion, you're going to miss it, and you might actually miss an opportunity to stop something else from happening. So I was actually gaslit mostly by women, which is unfortunate, and even women of color, which is also odd, because I feel like I chose women physicians on purpose because I felt like they would listen to me more. But it was just a very confusing and sad time, and scary. There were many nights I went to bed, and I'm not exaggerating, I didn't think I was going to wake up. Or is my heart going to beat this really weird? I had, you know, look like blood clots. I still had discolorations all over my body. My heart was racing in different ways, different times, with instructions of if you feel like it's not alleviated in 4 hours, just come to the hospital. If not, there's nothing we can do for you. So I would go to bed with my room set up in a way that if I didn't wake up, my family would not, like there was not things everywhere. And that's a hard place to be. And in the middle of this, I'm going to work and taking care of people. And I can't even speak for myself. I can't even take care of myself or my family. So in every piece of energy, with chronic fatigue as well, the fatigue started happening, and then joint. So it just progressed into this. At first, I felt like I never gave up, and I still had a mental fight. But it feels at certain points your body just gives into it, and it settles deeper. And it's a hard thing to explain, but it definitely does not feel like you have control. So every day you have a humility lesson. And what are you able to do for the day? What is your body telling you to do? And in medicine, you can't listen to that, because if something's happening at 3 o'clock and you're dying, it doesn't matter. You have to deal with it. So I chose that over myself for a very long time. And fast forward, started having migraines and having visual disturbances. I couldn't speak properly. I still stutter. Certain words that have certain vowels are very hard to say. And I made an appointment with a neurologist, nurse practitioner. It's too hard to get in with a physician, actually. And I was told this is just my age and it's migraines. I begged for an MRI. I got that. It showed some very strange dysplasia, like a hypoplastic vein in my head. And there's also a vein sticking out of my skull. It caused that? Absolutely not. Could it aggravate it? Luckily, I was actually writing everything on my portal. And I do suggest, if anyone is just starting this process, to take as much conversations with your providers as you can on email, and have everything, that's your documentation. And that is your proof conversation happened and how it happened, because luckily I have a lot of information in writing of conversations that there's nothing wrong, and me begging for help since May of last year. So it's hard to read.
And this is such a common experience to hear time and time again from other long haulers, with, going into the medical office and being dismissed by providers and not feeling that they're able to get the care that they're needing based on, how they're feeling in their body. So, and it sounds like this has presented for you in such a huge way from the very beginning. And it sounds like even still. So how, and you spoke, a little bit to, some of the ways that you've coped with that in terms of, documenting and, taking, a really detailed note of conversations and with your providers. But, can you speak to this, this medical gaslighting in a bit more in depth, and just in how you have navigated this really ongoing dilemma?
So I had heard the term gaslighting, but never associated with medical before. I have, had patients that said people don't believe them. And unfortunately, I probably have had some bias to certain diagnoses, and I hate to say, including POTS. I've not put much thought into any of the fibromyalgias, not to discredit. I just never really thought much of those illnesses. I've never really been presented with them in areas. So it's not something I thought a lot about. I didn't have an opinion either way. So, and I know that this has been happening to that community for such a long time. And I cannot imagine the devastation of feeling that for 20 something years, of being completely dismissed and heard. So, it's something that, again, is difficult. And I feel like you, advice-wise, bring someone with you to the doctor's office. Helps. My mother, actually, I gave her access to my chart, only to look through things, just to make sure that I have the information, that I heard the right information, because of my brain fog, and also to speak to the me that's different. Because I think when you have someone else with you that's saying, she isn't like this, this is not normal, that gives a little bit of credibility as to someone speaking for that. And I think learning through the process of also sharing that other things outside of my medical symptom list are still symptoms. So I have confused bank accounts. I have literally taken one account, put it, all of my utilities, including my mortgage, into another account that had no money in it. I know I did it. I don't remember doing it. I remember crying and fighting with the bank and having fees hysterically, and all of that. And then, you're running into all these things. So your picture is bigger than you think it is. And you need to use that, because the experiences that can back that up, because that's also sent to you in a letter. It's sent in an email. Proof that something hasn't happened that hasn't happened before. So I think there's power in knowing that you do have access to prove your point. And I also think that it's important to remember, and I do have to remind myself, I hired that physician. I choose. That is our right to choose the physician. I think that and I believe in telling them, because I did have a very, very difficult experience with an endocrinologist, because my only pre-existing symptoms prior to COVID were I had some thyroid nodules, so I had half a thyroid out, and ADD. So, I took supplements. I really didn't want to take the prescriptive thyroid medicine. It really made me feel crazy. So I just took supplements. So she literally told me I did this to myself. I walked out hysterical, and I am not that type of person. I don't cry, and it's hard to make me cry. But I was shaken. She looked at me and said, "I'm not interested in your pictures. You did this to you." And she said, "Stop taking your medicine." And I said, and so this was a referral. So a primary care who initially gaslit me when I begged for a referral for rheumatology. In writing, she said, "Why do you feel like that? Stop diagnosing yourself with post-viral syndromes." So that took me back. And it's in writing. So I asked my husband to read it. I said, "Am I interpreting this incorrectly?" And he said, "No, that's wow. And so I responded back with, "I need help." I attached pictures of my swollen red knees, begging for help. And she said, "You have no indication for a referral. You need to find another provider." And it just put me in a situation of, what am I going to do? So I had my thyroid levels tanked, which I'm now seeing that's happening to a lot of people who were controlled prior to COVID. And then their thyroid levels, for some reason, are very uncontrollable during the Longhauler situation. So instead of looking at that, you're blamed. You did something. So I saw that. I stopped. This was in May of 2020. I stopped every supplement, I took vitamin C, zinc, and a baby aspirin. That's it. Because that's what they told you to do. Stopped every one of my herbs, anything like that. And so when I went to see this endocrinologist, it was maybe 3 weeks later. And I told her, white flag is raised. You tell me when to take the medicine. I'm not touching anything. And she berated me the whole time. And, said, "Let's check your labs again." And I know that it takes about 6 weeks for your thyroid levels to, it's a hormone. So it's going to take a minute for it actually to move or change. So she wouldn't release my results to me. In writing, she put, "Stop your medicine as I told you to," in caps. And I had stopped them. So I fired her in writing as well. I told her that she was, that I felt berated and I was not listened to, that she was not an advocate, that she was an adversary, and that we did not have a good working relationship. And then I asked her, "How long does it take for a thyroid hormone level to level out once medication or supplementation is stopped?" And this was 3 weeks after I had stopped it. And her response in writing was 6 weeks. So I replied back with, "And you're yelling at me at 3." And
So
that was that.
the moral of the story here is really feeling like you do have the control to choose who is a part of your healthcare team.
You do.
And to feel like you don't have to be married to a certain provider because they are your provider. If you're not receiving the dignity, respect, and support that you deserve from a healthcare provider.
Yes, and every facility has patient relations. If you're not comfortable face to face, or if you're not comfortable actually writing something directly to the physician on your portal, patient relations is also there in a capacity to help guide and also file complaints, or to you don't even have to file a grievance. You can just file an observation, so that physician's actually just notified, and there's a conversation on their end about what they need to do for actually, to provide better patient care. So
the fight exists on many planes.
Yeah, it's so real. It's so real.
When you say you're a fighter, like, this is not an exaggeration to say. And circling back to something that you had said earlier about this, like, of course, COVID-19 is something that physically affects the body, but it also is a mental battle. And in the coming weeks, months, year of ongoing and long-term chronic symptoms, you had mentioned, like, you have to put the mask on yourself first before you can help others. What are some self-care practices that you have brought in? It's a learning process, right? It's like, okay, learning what you need to do. But can you share with us maybe a bit of how you've been taking care of yourself?
Yes. So my sister is a Reiki practitioner. So we've been doing a lot of succumbing and a lot of work that way. But I do think that there is a perception, especially with women, that you are, to quote like Glennon Doyle, you're a cheetah in a cage, and you are to grin and bear it. And that's how it works. And you just move on. And I think by being taught not to trust yourself is such a tough thing, especially, I don't have a daughter, but that's, to me, if I did, that would, at this point, would be such a lesson. When you feel something, you validate them, because it teaches you growing up that what you're feeling isn't right, or that you're wrong. And I think that is what happens to a lot of women, even in a conscious situation where it's not what's meant to be happening to you, but it's how it comes across. So I questioned, is it really as bad as I think it is? Maybe I am over exaggerating. Maybe I'm just tired. Maybe, I have 800 maybes. But I think, when you look at it for real, there's so many studies, especially, there was a webinar this morning about the importance of the length of long haulers with rest in the beginning. So I think off the bat, if you're able to, I think it's a very difficult situation when someone financially is the breadwinner and doesn't have the resources and opportunity to take off for a certain period of time. But I think that if I would have learned my limits earlier, I wouldn't have tried to push. And I'm full of analogies, but that whole, the life vest, and then the boat, and then the heavenly gates. I started having horrible migraines and went into spinning constantly, like vertigo. I could not even stand up straight for 7 days in the ER because I could not hold down Pedialyte at all. My husband was like, "Heads, we're done, we're going." And I also had a unique situation where my husband is very pragmatic and didn't believe anything. He had to see it. So up until me throwing up, or up until a seizure, there was nothing's happening to you. You're fine. So
it's really difficult when you're dealing with an invisible illness, right?
Correct. There's so many, and you had to put that happy face on and go to work, and cry in the car till you got there. And, just that kind of stuff. I mean, and a lot of times what I did learn in this is helping other people helps me. But when I have to mask completely that anything is happening to me, it was very counterproductive. And I was getting to where I was snapping at people, fellow coworkers, even patients, unfortunately, that were just really irritating, you know, and where I am backing up and apologizing. And it's like, what am I doing? And I actually had an honest conversation with myself, weirdly enough, about a week before I started having physical tremors. What am I doing? My blood pressure's sky high. I have this vein in my head that no one will recognize. And I know from science that you can't have that. So, and that was, I think, another thing too, is the focus is so hyper focused on this new virus when post-viral syndromes are not new.
Yeah. Mm-hmm.
And there had been a pattern from the beginning, because pretty early on, one of the infectious disease doctors told me, be careful. This is turning into ME/CFS in Europe. So the first thing I did was, when I went home, is Googled what causes ME/CFS. Because like I said, I didn't have an opinion before. I knew it existed, but I didn't know what caused it. So the first thing I see is Epstein-Barr. And I'm like, oh, I had shingles. Oh my God. I had mono really bad. I knew that in high school. I had shingles. Could it be reactivated? He wouldn't test me. I purchased my own and did all the stuff and got all the right labs and showed reactivation. And he said, yeah, I'm not treating it. The treatment's too long. I said, well, I really don't want lymphoma. That's somewhat could be a cause of that. And he said, yeah, not treating it. And at that point, I started going into chronic fatigue groups, figuring out what their struggles were. What are these people dealing with? What are their symptoms? Oh my God, this matches. Oh, well, now we have a problem. And then it turns into, this isn't new. Yes, the virus is new. It has a different pathways, but I feel that they're using that as a complacency issue. I do think the medical system is set up in a way to fail, with the physicians included. You have 15 minutes. You cannot assess a person, make rapport, you know, have a rapport adequately in any way, shape, or form in 15 minutes. You're not even going to chart properly. So that is a disservice to everyone. But I also think that it alleviates the curiosity of science, because science is curiosity. And if you take the ability to be curious away, you take discoveries away. You take connections that you don't have the time to make. Meaning, you know, wait, if this correlates to this, then let's ruminate on that for a minute. They don't have time. Mm-hmm. They just automatically go to no. And you're just like, wait, but like, there's something to this, you know, we're correlated. There's something that matches. It's a virus. It's causing issues that we don't know. And we have to me, the unique opportunity to have a lot of people in the ME/CFS community don't really know exactly when it happened. They just knew when their symptoms happened. With this virus, I feel like we are missing such an opportunity to actually make a way to cure this, because people know when they were exposed. You have a timeline and you have a before and an after. And I call it, you know, I don't want to offend people, but I call it BC and AC, before COVID, after COVID, you know, because BC, I was normal. After COVID, it's a whole nother ball of wax. So, you know, it's very difficult when you're dealing also with a medical community who is constantly negating, and also feel like the media has turned into whatever narrative they want to give. Like, I have massive anxiety about July 4th reopenings. But, you know, it's hard for me to say sure when you look at things and there's data that anyone is getting through this fully vaccinated and getting these variants. You know, it's just, to me, it's a dangerous situation. And
this, your personal experience here with, you know, going through all of this and what comes on all of these different battlefronts has, you know, inspired you to take a bigger step into advocacy, you know, the realm of advocacy. So I'm wondering, just in our remaining minutes, if you might be able to speak to some of the advocacy work that you're doing and the importance of it.
Yes. So, and some of my advice, like I had said before, is to not ruminate too long into the groups, because, you know, it does spiral you into a situation where you can feel hopeless if you're looking at everyone suffering. So I started going into groups that were more of an advocacy focus. And honestly, I signed up for anything and everything. I didn't even know what was happening. And I was getting these Zoom invites and I'm like, wow, well, this is really cool. What is this? So it's the opportunity to actually represent us and to work with a group of people who have already established alliances, as we are called the Long COVID Alliance, with administrators and legislators and lobbyists, and you have an opportunity in a platform that's very unique is to share your voice and to make a difference. So if I think everyone's journey is for a reason, to make sense of this, I have to believe that I do believe in God. So I believe that this has happened to me for a reason. And as long as I'm 6 feet this way instead of this way, I'll use it, my voice, to make, those voices that have died not be in vain. And also to make whatever awareness for the poor people that have heard for so long with these silent chronic illnesses. We need to be heard. And there's, a lot of us talking can make a loud noise.
This is such a grassroots movement in many ways, and like through the the long haul, like COVID Alliance, yes, with bringing together, patient experiences and pooling together resources and other people who are a part of an establishment that at the end of the day, does need to change. And, COVID-19 is just the latest and most overwhelming example and mediator, I think, of like this, really highlighting some of these areas like, okay, this isn't working. It's a dysfunctional system, as you had spoken to earlier, for a number of reasons. And
it's exciting to actually be able to speak to other people on platforms that I would never have actually gotten the opportunity to meet, and just to see, what do you think about these things? Because I feel like if everyone thinks like me, it's boring. And so I like diverse conversations or just different viewpoints, because to me, I always feel like a good meeting is when you change my mind, or you can give me another perspective to kind of go, I didn't think of it that way, but I like it, and that kind of thing. So I think that there's such a high level of people that makes you better. And I think going forward, I thought I had empathy before, but my empathy level is now like exponential in understanding. Right. So it's, and I actually think that it's changed the course of what I want to do for a career. Like I know the hospital system was broken before COVID happened and everyone did the best they could. I don't really think there's a blame. I think it's a universal blame. So there's nothing singled out, but I definitely ethically don't align anymore. I feel like there's another purpose that I want to explore. What's going to happen, or I'm riding with it. So, but I definitely think that there's a way and a platform to use this for a better healthcare system, for sure.
Yeah.
So,
well, Kerri, I really want to thank you so much for being here with us. And is there anything else that you wanted to add to this conversation before we close?
No, I just thank you again for this opportunity and this platform. And I think your app and the idea is such a great idea. I think it's going to bring together a great group of people with some great resources. And I've just been playing with the app for a little while. I've really enjoyed it. And I like the questions. I like the thoughtfulness of some of them. Sometimes you don't think of what you would ask yourself, but yet when it's posed in a different way, you're like, oh, wait, I do that. So I think it's a good little thought process. And I think it teaches you a little bit of mindfulness that sometimes it's hard to grasp at this, especially when you're sick. So I think it's shifting a little bit and knowing that you have help, like you guys have the coaching and stuff like that, is such a good thing. So I'm just thankful that you actually, that we're actually able to even chat and, share. So.
Well, it's just such a pleasure to have you here with us, Kerri, and just speak to your experience and also the incredible and amazing and really necessary difficult work that has to be done in this space. And so thank you again so much for being here with us.
Thank you.